Vaping has overtaken conventional cigarettes as the most frequent form of nicotine consumption in teens and young adults. And while the perception among many is that it's a healthier form of getting your nicotine, over 2,800 hospitalizations in the US point to a different story. EVALI, e-cigarette and vaping-associated lung injury, is a potentially fatal acute respiratory disease. It's caused by chemical damage and characterised by an inflammatory response. Cases of EVALI have been described in patients with daily vaping exposure, as well as in users who reported vaping at least once a month. While largely a US issue and labelled a nationwide outbreak by US health watchdog, the CDC, there have also been reported cases of EVALI in Australia. Today, we're looking into the case of Michael, a 27-year-old man from Melbourne's leafy inner suburbs. Michael presented to hospital earlier this month with shortness of breath and a persistent cough. He was feverish and suspected an infection of some kind. Doctors noted Michael was relatively health conscious, a regular gym goer with a healthy weight and body mass index, and no family history of genetic disease. Pulmonary function tests examined how well Michael's lungs were able to inhale and exhale to deliver oxygen to his body. They revealed reduced airflow and low diffusing capacity, indicating impaired oxygen transfer. This suggests possible lasting damage to Michael's alveolar capillary membrane, the vital surface for gas exchange. CT scans showed damage similar to that seen in serious infections like pneumonia, COVID-19 and Legionnaire's disease. Signs of inflammation and evidence of fluid buildup was prominent when compared to normal. Doctors' suspected diagnosis, or differential as it's known medically, was thus a pathogenic infection. However, this possibility was eliminated through lab testing. Michael was given supplemental oxygen, but quickly deteriorated and was admitted to ICU. His lungs were failing, and he needed mechanical ventilation to breathe for him. So how does someone healthy and fit like Michael end up in intensive care in just 24 hours? It's not just the vaping. The real story goes deeper. Beneath the slick branding, wild flavours and Instagram hype lies an unregulated cocktail of chemicals cooked up with zero quality control or toxicity testing. It's what's in the vapes. With over 8,000 flavours available, many with fun, sugary names, these vapes contain additives we know almost nothing about. Looking closer, what have case reports found at the core of EVALI cases? Two major culprits: THC, or tetrahydrocannabinol, and vitamin E acetate, or VEA. During the US outbreak, 80% of hospitalised patients used THC-containing vapes, a synthetic cannabis product. Even more concerning, over 84% of those products were sourced informally. That means garage labs, online forums, and homebrew backyard chemists. Vitamin E acetate, a synthetic form of vitamin E. It's safe when ingested or applied to the skin, but dangerous when inhaled. It's often added as a cheap thickening agent in illicit THC products, making low-quality THC oil appear velvety and golden, while also enhancing its scent and taste at a minimal cost. But stretching profits comes at a price. Vitamin E acetate has been found deep in the lungs of EVALI sufferers. When we breathe, air travels down the trachea, through the bronchi and bronchioles, and finally reaches the alveoli, tiny air sacs where oxygen is exchanged with the bloodstream. The alveoli are at the centre of EVALI. This is where the injury begins and where we'll focus our attention. Vitamin E acetate acts as a chemical irritant. These substances disrupt the delicate alveolar environment, damaging cells, disrupting surfactant, and triggering a rapid and intense immune response. 1. Chemicals accumulate in the alveolar spaces, embedding in the tissues. 2. Inside the alveoli, chemical exposure generates reactive oxygen species, which damage the alveolar epithelial cells. 3. Sensing injury, immune cells flood the area. These cells release inflammatory signals, recruiting even more immune cells. The inflammation causes fluid buildup or edema and disrupts gas exchange. 4. Immune dysfunction presents as lipid-laden macrophages, immune cells overloaded with lipids. These cells are prevented from clearing away damaged tissue, further dysregulating the immune response. 5. The lung tries to heal. Type 2 pneumocytes grow excessively in a process known as hyperplasia. These cells try to regenerate the alveolar lining and restore surfactant production. But the healing isn't perfect. In many cases, disorganized tissue repair leads to fibrosis and structural changes. EVALI can present in different ways, but certain patterns of injury appear again and again, both under the microscope and in imaging. When we look at normal tissue at a large magnification, we can see lots of space for air. In comparison, EVALI lung tissue is filled with fluid, inflammation, and structural changes. Most common findings include diffuse alveolar damage, or DAD, widespread injury to the alveolar capillary barrier with fluid leakage as shown in the biopsy here. Fibrinous exudates within airspace. Protein-rich fluid from cell damage leaks into alveolar spaces in DAD, filling a space that should be empty. Intense inflammation. Immune cells like neutrophils and macrophages rush to the site to fight off the damage, and these cells are visible here. Lipid-laden macrophages. Immune cells filled with fat droplets have impaired function. And organising pneumonia. Plugs of fibrous tissue blocking airways and alveoli. This is an attempt at repair, but it's evident how these plugs can restrict airflow. These structural changes all fill a space that should be clear, interfering with one thing: gas exchange, the lungs' ability to deliver oxygen and remove waste. Together, these findings, from the scans to the cell stains, help doctors confirm a diagnosis of EVALI, guiding urgent treatment. What are the health impacts? This is an acquired disease from chemical agents, and the onset is rapid. EVALI patients are at risk of serious complications, including progression to respiratory failure, acute respiratory distress syndrome, or ARDS, and even death. The majority of cases need oxygen supply. Over half of patients need ICU admission, and 1/4 need mechanical ventilation. Michael's prognosis is poor. He's in the ICU with advanced disease and significant, largely irreversible cell death. Patients who evade ICU admission have a better prognosis. Their injuries are considered sublethal, and cells can repair in time. The long-term effects of EVALI are unclear, but early evidence from animal studies suggests survivors, especially those who continue vaping, may face chronic issues like reduced lung capacity, difficulty exercising, and increased vulnerability to viral and bacterial infections. On that note, it's time to make a choice. Quitting now gives you a chance at a better future. If you or someone you know vapes, it's not too late to stop. Visit quit.org.au for free and helpful support.